Good morning and welcome to the Safeguarding Education Overview and Scrutiny Committee, today on the 20th of February. Item 1, apologies.
Thank you, Chair. We have had apologies from Mrs Perry, Mr Wildman, Mr McMahon and Mr Bell.
Thank you. Item 2. Item 2, any declarations of interest? No. Item 3, the minutes of the last meeting held on the 9th of January. I take it everyone's had an opportunity to look through them and happy that I signed them as a true and accurate record.
Yes.
And moving on to item 4, the main item this morning, Children's Services ILACS Improvement Plan update. Members will probably recall that we were updated on this particular plan last June, and several members thought it would be useful if we could have a further update on it. Councillor Sutton, did you want to open?
Thank you, Mr Chairman. Good morning, members, colleagues. And of course, I suppose the main change since June, when you were last updated on this, and now is in that period of time. Obviously, we've had a new Director of Children's Services, Bernie, who's with me this morning, together with Natasha, who I know you all know well. So, the presentation today, it will be an update on the ILAC improvement plan for yourselves, and the inspection was conducted in November 23, and it identified 4 key recommendations focusing on management oversight, performance data, quality assurance and oversight of allegations via the LADO and partnership with housing and health providers. So we've got a series of slides today on the progress being made, and the Cabinet has taken this seriously and has taken several actions to support the improvement programme, namely revamping the Children's Improvement Board to provide improved partnership input with regular input on the improvement plan, and we've secured additional investment for key aspects of the plan, including but not limited to increased leadership capacity, auditors to externally validate our work, to help procure the new case management system, added capacity to the LADO and increase the overall spend on the care leavers offer. I think these actions help to demonstrate the commitment we have to driving improvements and ensuring effective oversight and support for the improvement progress. And the presentation will talk more about the leadership of the plan, the progress made and the key challenges that we still need to overcome to achieve a good judgment. And just one particular point is that one of the things in the inspection that was raised was the care leavers offer, and we have in a position now where that has been improved, and nearly, well, round about £500,000 per year of revenue has been invested in that to make the offer substantially better than it was. And if you make a comparison between that and what's available around the country, we are at least on par, if not better, than offers around the country now. So if you're happy with that, I'll hand over to Bernie to take you through the slides.
Yes, thank you, and please do. Thank you.
Good morning. So, as Councillor Sutton said, and you will recall yourselves, there were 4 key recommendations that I won't repeat because Councillor Sutton has just read through them, and we wanted to give you some kind of updates on progress of those. So in relation to the first, which is the quality and effectiveness of management oversight, we've done a full review of the quality and effectiveness, and there has been some improvements embedded in kind of Q2 of 24-25, but many challenges still kind of remain in the front door in terms of the volume of work that's coming through, and we are still working around the strengthening of the MASH, particularly in relation to the partnership functions. So while health and police are co-located in Lindham House for the MASH, we know that it's not working as effectively as it could do, and so there's still some ongoing work in relation to that. We've had a new improvement consultant working on the review that was brought to scrutiny, working on kind of unpicking that, why progress hasn't been made in terms of implementing that, and really some very strong engagement with the partnership, because the multi-agency safeguarding hub is a partnership function. It's not something that the local authority can deliver the effectiveness on its own. We're also looking, you'll be aware that there has been a new Wellbeing and Schools Bill announced, which will come into force in 2026. So we're looking at how we need to modify, change our front door arrangements in order to be ready for the expectations of the Wellbeing and Schools Bill, which, for example, means that every family needs to have a family decision-making meeting as soon as possible. And so there's some kind of changes in resources and investment that we're in the process of exploring in order that we can meet the expectations of that bill. We have created a set of practice standards. So there was an absence of practice standards previously. Those have now been created, and we're working at how we embed those practice standards, along with embedding more effective performance and quality assurance arrangements, which include multi-agency audits. And then we are in the process of procuring a new case management system so that we can move away from Care Director, which is quite cumbersome, and move to something that is much more kind of intuitive and will support practitioners in their work, and in that's across the wider service area. So the second recommendation was the effectiveness and impact of performance data and quality assurance. So we've reviewed the governance arrangements for operational and strategic improvements, and as Councillor Sutton has already referenced, we've looked at the revamping of the Children's Improvement Board at a strategic and operational level, and are working towards setting up a Staffordshire Strategic Children's Partnership, which moves us kind of out of improvement and looking at how the wider system and the partnership can impact better on outcomes for children, and really getting partners to the table, accepting their responsibilities as shared responsibilities for safeguarding children. We've appointed 2 improvement consultants, one for children's social care and one for youth offending, and 3 auditors to create some capacity, and also to ensure that we have got individuals who are moderating our own views of our practice. So in essence, we are moving away from marking our own homework and making sure that we've got some challenge and scrutiny in the system. And then we are currently in the middle of a review of the senior leadership structure to create more capacity in the senior leadership structure. I think my view is that the structure that was in place was very small for such a large authority, and the expectations in children's services to oversee and have a granular understanding of practice required a slightly larger leadership team with more specific portfolios, and then there will be a phase 2 of that work, looking at where staff sit in underneath those portfolios. The third recommendation was in relation to the LADO function, and we have engaged a peer review from the LGA, which is now completed, and we are in the process of following those key recommendations. We're not going through the set of slides in relation to the LGA peer review, but they will be sent to you just so for your assurance, so that you can see what the issues were and what the findings were in relation to that review. We've launched a LADO dashboard, which makes it much easier to understand the kind of level and scale of work. And we've also created some additional capacity in that team, which was one of the issues, and recruitment is underway. Again, in order to improve the LADO workflow, the procurement of the new case management system is essential, and there is obviously linked to that is the work of the MASH, because at the moment the LADO function sits in the MASH, it may not be the right place for it, and we'll look at that as we do further restructuring. And then the fourth recommendation is around the effectiveness of partnership working, with a particular focus on housing and health, children's access to dentistry, and more complex needs. So there's been a review of governance and the scope of the strategic partnership, and the links between the Health and Wellbeing Board and the Children and Family Strategic Partnership. And there's a session next week to really focus on the priorities of the strategic partnership, and how we move that forward as a collective group of senior strategic leads across the authority. New multi-agency partnership arrangements were published in December 2024, and that links into the government expectation that we would have those new arrangements, where you've got 3 designated safeguarding partners: the local authority, health, the ICB, and Staffordshire Police. Excuse me. We've strengthened the corporate parenting panel and the health and healthy care partnership, very much focused in the corporate parenting panel on holding health colleagues to account in terms of access to dentistry for our young people in care, and making sure that those appointments were more timely and in more appropriate locations to encourage attendance. As Councillor Sutton's already referenced, we've been fortunate to have political and leadership support from the Chief Executive and wider SLT to invest in the care leaver offer, which was signed off in January, and we'll see young people get access to a whole range of additional resource, including support for paying council tax, access to driving lessons where they need them, access to travel benefits, and access to digital benefits, kind of mobile phone, SIM card, Wi-Fi, etc., which I think are really critical, particularly as the cost of living continues to impact on the wider population. Some of our care leavers are struggling, and it's been a really important step, I think, in the commitment of the council to that group of potentially vulnerable young people. We are submitting a multi-agency bid for a complex needs care home, which goes in at the end of next week. That's with the DFE. It's capital money that we're bidding for, but will be a great opportunity to further support some of our most vulnerable young people who were often challenged to find appropriate therapeutic placements for in Staffordshire. And then we've had a homeless protocol approved by the districts and boroughs, with re-engagement work with the local authority and improved leadership oversight of unsuitable accommodation. I think one of the things that we've done is we've done a piece of work where we've reached out to the district councils, and Natasha has led on that, engaging them in discussions about their corporate parenting responsibilities, but also their duties in the housing space, because they do have their responsibility for housing, and we have some real challenges in some districts around housing availability for some of our care leavers. So in terms of our key challenges, we've still got work to do to ensure that the corporate parenting role is understood, and that organisations accept that they need to work with us and support the changes that are required. There has been investment in the partnership, but the culture change is significant that needs to happen, and so we're doing some work with an external facilitator to support that work. I think that there's an awful lot going on, both in Staffordshire, but also a lot of external pressures nationally. So it's really important that children's services improvement remains as a priority, particularly now we're in a space of focusing on what devolution might look like for the county. It's really important that we still remember that we've got a cohort of vulnerable children, and that we need to make sure that their needs are prioritised and they're not lost sight of in those other challenges that are facing us. And the size and the scale of the county means that consistency will take time to embed, and performance won't always be linear at this time, and it's about keeping a watching brief on that. So, next steps. So we have an annual conversation. The last one was on the 4th of July, 3 days after I arrived. This one will be on the 2nd of July, I think. And that's where Ofsted challenge us on, well, what progress have you made so far? What have you done? What is the evidence of the impact on children? And so that will be quite a significant conversation, because at that point they will then set an indicative date, a window, for us to have a focus visit on one particular area. So a focused short inspection on, they might choose care leavers, they could choose the front door, we don't know. They don't tell us until they give the call, but on the 2nd of July they will give an indication of that window, whether that's, you know, early autumn, late autumn, but we need to be ready for that, and we need to make sure that our responses and our practice is robust. We're implementing the new leadership structure. The consultation will close at the end of February, and then we're looking to go out to advert for new roles, probably middle to the end of March. We'll continue working with the independent consultants in key areas, giving us a bit of extra capacity to get underneath some of the practice and think about what the solutions might be. Continue to engage with partners to implement the directions from the Wellbeing Bill, and we've got a meeting with the DfE next week around summarising what our intentions are, and really listening to them about what their expectations are of us. And so that's something that we'll then have discussions with Councillor Sutton in relation to what we need to do, where we need to be. Again, devolution is going to have an impact on place-based working, and we need to be aware of that, and to be picking up the concerns of staff in relation to how that will be. But, you know, very much focused on business as usual. Children still need to be looked after, children still need to be safeguarded, and we can't let devolution, as important as it may be, distract from that. Embed the knowledge and understanding and good practice that is emerging to improve the corporate parenting role, and really embed the practice standards which were previously absent, and really critical scaffold for staff to understand the basic expectations of delivering a good quality social work service. And then monitor the impact of all of these activities to make sure that we can evidence impact. So it's all very well to be busy doing, but you have to be able to evidence that your doing is having a positive impact on the lives of children and families in Staffordshire. Thank you, and I'm open to answering any questions you may have.
Thank you for that. If I could just start just with a couple of general questions. It is interesting, isn't it, about the devolution and where Staffordshire sits in this. And we only heard, I think, last night about Stoke-on-Trent and their potential plans. And the future for Staffordshire isn't always obvious at this present moment in time, unlike perhaps a lot of other local authorities. And you talked a lot there about place-based learning, and in particular around care leavers and the homeless, and a reliance on district and boroughs. Given that uncertain future that we have around the formation of strategic authorities, what sort of reassurance do we have that these issues around vulnerable children will will be managed well amidst all of that?
I think there's a very clear commitment from the leader, certainly at Cabinet yesterday. He articulated his very clear and ongoing support for children's services and that priority of making sure that our children and young people are safeguarded. I think that the district chief executives have engaged really well in a dialogue about their roles and responsibilities, and the wider partnership are engaged in a conversation, and it's important that that conversation stays on the table. All of the partners have got financial challenges, the ICB, the police, and the current climate that we find ourselves in is challenging. So I think that the priority is there. There are regular checks and balances, not least with yourselves at Scrutiny, and I think we continue to have children and families front and centre, and to make our presence felt in terms of that challenge and support that we have with our partners and our district colleagues. I did say that Natasha had been out meeting with district chief execs and re-establishing the relationship between our district staff and the district council officers, and we'll continue to build on that. We've done some work on digital profiles, district profiles even, which really helping us to understand where need is most high, so that we can respond to that. So really thinking about how we place our resources where they're most needed, rather than just everybody having the same amount of resources across the county. So really engaging in the dialogue around that, and looking at linking up, working as a system, having a system response, so thinking about children that might be missing school, how that links into children who end up in the criminal justice system, and really starting to join the dots with various information and intelligence that we have about children and families across the county, and using that to support our best endeavours. I think that there is a much stronger focus, both in the council but with external partners, on our ambition for children, and our ambition to improve our Ofsted outcome, but that isn't the driver. The driver is supporting children and families to make sure they're safeguarded.
Now, thank you for that, but I also think that when we think about that larger devolution question, certainly in Staffordshire, it would appear, on a very simplistic understanding, that we probably won't look north, east or south, because they already strategic authorities in existence there. The issue around Stoke-on-Trent, because that Stoke-on-Trent have previously made a decision to remove themselves, haven't they, from a joint working arrangement with Staffordshire around protecting children. And when we therefore look west towards Shropshire and their current issues, it just feels like we're in a bit of an uncertain mix around where all of that is going, and perhaps having to form strategic relationships with authorities that have previously indicated that they didn't want to work in a broader Staffordshire setting. And just taking that one step further, it was interesting when you talked about Ofsted, I think will be coming, I think you said in July, and looking for evidence that we have made a difference. In light of all that almost confusion, are we, or could we be reassured that we will have that evidence to be able to present?
Just a couple of things in response to that. There's a new Director of Children's Services starting in Staffordshire on the 10th of March, Neil MacDonald, and we've already made a commitment to have ongoing dialogue with each other about the work that's going on across Stoke and Staffordshire. That's supported by the leaders and the chief executives and the lead members, so that we can ensure that those children that cross boundaries, and we have many children that cross boundaries with many of our children that live in Stoke and vice versa and attend each other's schools, that we've got a real and clear shared focus on those children and that collective commitment, because I think that's important. I know that the disaggregation happened in relation to the safeguarding partnership and the front door, but I think the shared commitment to supporting children that live in the widest context of Staffordshire is still important to us, and hence the reach out to the newly appointed Director of Children's Services. Ofsted are not coming here in July, just to be clear. We have an annual conversation. It happens in Birmingham, so that's not the point that we're inspected. So that is a summary of what we've done so far, what our data looks like, and that challenge. And then when they come to the inspection, probably in the autumn, and they'll say, well, you've got all that, but so what? What's the impact on children? Are children having good services? Is there evidence of good work? We've got evidence of good practice, but as I said in the second to last slide, it's hard to get consistency. We're working hard. I think it'll be really important to embed the practice standards. They are the scaffold for good social work practice, and they have been previously absent, so we're now putting those in place, and we will try and embed them. So we're hoping that we will be in a position where we can show a trajectory of improvement, and we would be hopeful that Ofsted would see the efforts that have put in place, but it's a significant journey, and it would be wrong of me to suggest that it's suddenly all going to come back and be incredibly positive, because there will be challenges because of the scale of the county. We've now got 1,300 children in care. It's a big cohort to support. We do well from a workforce point of view. We've seen a reduction in the numbers of our agency staff, and we've got more consistent kind of leadership and social work staffing, but there are certain areas where that still remains a challenge, and we need to support those particular areas more effectively.
Thank you. I think, just for clarity, I think you meant Stoke-on-Trent, didn't you, when you were talking about the director? Yeah. You're not moving on, presumably.
Sorry.
Councillor Sutton.
Yes, I can reassure you that we are not having a new DCS in Staffordshire. A couple of points I think that raises. I think whatever a strategic authority looks like in the end, and I think the government's made it clear that every part of England will have a strategic authority. Mayor-based or whatever. I think that will help to strengthen relationships between the component authorities, and however they're made up at the end of the day. From that strategic view, which I think will help with some of the other things that are still intended to be delivered by individual local authorities. And going back to a point that was made about the work that Natasha's doing within districts, I think one of the original aims previously of going to a district model is that it would enhance that place-based working. Teams would be based in districts, and they would be able to develop relationships with district and borough colleagues and other people and other partners that are working primarily in the district. And I think it's fair to say that that hasn't happened as well as we wanted for a whole host of reasons, and that was a real important part to me of why we went that way. So it's good that now we've taken that mantle and we are able to try and work better in that way, because that was one of the fundamental reasons for doing what we did. And the last and final point I want to make is that, I think we've got to be very careful that devolution and strategic authorities and unitaries and all what's going to happen going forward around that doesn't get in the way of the fundamental thing of us delivering, a good service for children in Staffordshire. And these things can sometimes get in the way, can't they? And I think we are determined that will not be the case, and that we will carry on ensuring that we have that continuous improvement as we go forward.
Thank you for that reassurance, and I think you're absolutely right. I suppose which brings me on just to another question around the effectiveness of management in the process. I think we were talking about sort of cultural change and having to change cultures of not only our own organisation but perhaps others as well. And it does seem to be a persistent criticism, doesn't it, that there is that, if lack of is the right phrase, oversight and overview of management and supervision. Could you give us some examples of what those obstacles are, what that looks like, and whether we can, again, rest assured that we will overcome whatever those cultural changes are?
I think previously, as I've said, that there wasn't practice standards. So practice standards form your basis for how you supervise people, what your expectations are, how you hold people to account, how you might manage people who maybe aren't performing as well. In the absence of those, it becomes very hard to hold people to account. And I think that was then, this is now, we've now got them, we're now having conversations about that more robust expectations of what people do, how they do it in a structure. We've also invested heavily in supervision training, which has been mandated to everybody who supervises staff, so at team manager level and above. And it's really important to get an understanding of what supervision should look like, how you engage in a conversation with staff. And we're also, through the work of the Operational Improvement Board, reviewing the current supervision policy, which probably isn't where it needs to be in terms of it being created in a more collaborative way. So we've done quite a lot of work in terms of what the structure looks like, and then we'll start to look at what the impact of that is. I wouldn't want to underestimate the challenges of delivering that at scale. And you know, we're working with human beings; it's not a factory, and so there is a variance in people's ability to take those instructions, to move forward in that way. But I think that we're on a positive journey in terms of understanding and engaging in the right conversations about practice standards, about the expectations of how we work both with children and families, but how we work with each other. Because from my point of view, there's no point being very respectful of the children and families in the communities we work with if we're not respectful of each other in that professional context. And that's been a really important part of that culture change and how we move forward. So I think we've got some building blocks in place, and then we will see the impact of that through our auditing process in terms of how we embed the supervision policy, the practice standards, and the expectations of the quality assurance. And I think having external quality assurance staff in has helped us to really see, to stop us being over-optimistic about the quality of practice and then really get into how do we improve it.
Are those practice standards partnership-wide?
They're social work practice standards, but we are doing work through the strategic partnership around the partnership engagement, and obviously the practice standards for the partnership are defined in working together, which is a statutory legislation. That is what defines how we should operate as a strategic partnership in relation to safeguarding.
Thank you for that. Councillor Snape.
Thank you, Chair. I worry that any breakup, I mean, if you look now, we've got Stoke perhaps wants to go at Newcastle with Moorlands, and I'm told there's another group of 3 who may wish to break away. One of our lead partners is Staffordshire Police, involved in our safeguarding. So if we had 3 unitaries for what is now Staffordshire and Stoke-on-Trent, they could all have separate social work policies, children's service policies, adult safeguarding policies. I just wonder how the officers in Stoke, in the police force, would deal with it. The chief constable, because we'll have 1 chief constable still, so who would deal with it? That's my big worry. My second point really is, having been the opposition lead for 7 years in a district, districts seem to work on a 1-year cycle. Nothing strategic. How do we get to the next budget? That's the big thing, really. And when we look at social services, we're talking about long term. We've got children in care who may be in care from the age of, well, from birth up till 25, we were looking after them. I don't think districts even think that long term, and it does worry me. I mean, if we look at our health scrutiny, there'll be a nominated person from a district come to it. How many times do they go to it? We have nominated persons to go to social services. How much to go to it? They look internally so much, and I just think it'll be such a big jump. For the first few years, it'll be very, very difficult for these, and I do worry of the effect it will have on our children care.
So I think in terms of consistency, working together is the framework, and working together is a legislative expectation across the whole of the country. So there shouldn't be differences of approaches, because you have to comply with the legislation. And then the Wellbeing in Schools Bill provides another framework that is supporting the delivery of practice and the expectations of family help, particularly, and that access to family decision making. So very much focused on community-based decision making, place-based decision making in communities, which places a stronger expectation on district councils, on communities, to support families who live within those communities. I think that trying to be proactive around, elements of what Devo might look like that we don't quite yet understand is why we've proactively reached out to the new Director of Children's Services in Stoke, so that we can start to have a conversation about kind of what's the same and what's different, but actually keeping children at the centre, at the heart, because that's what we're all committed to. And I think in relation to Staffordshire Police, they already cover the totality of the county, and that won't change. Their neighbourhood policing model, I don't think, will change. There'll be different kinds of conversations, obviously, but I think we're getting ahead of ourselves, because at the moment we've got a piece of work to do in Staffordshire about improving our services for children. And if we allow ourselves to get distracted about the what ifs and maybes of devolution, we will take our eye off this incredibly important ball.
Thank you. Yeah, Councillor Snape.
I see it slightly different, I'm sorry. If we have 3 unitaries for where Staffordshire is now, they'll all be able to go their own way. You say about working together, but they can say, we don't want to work with you, we're now independent. We're getting our money in, we've got our leaders, we do it this way. And that's how I see it, and that is what worries me. And we talk about Staffordshire Police's neighbourhood thing. It's great, but it doesn't work. Neighbourhood policing isn't working nationally, because response policing is suffering. I've got 2 sons who are police officers, and basically neighbourhood is being neglected totally across the country. That's why the government have actually said they want to put more into neighbourhood policing. But all this neighbourhood doing is catching up from response policing. And that is a problem. So I think we've got to, at the moment, we're being honest in Staffordshire, there is no neighbourhood policing really. It is all being spent on response, because that's what's got to happen. There's an awful lot of calls on police time, far too many, perhaps a lot of it is unnecessary. And those who should be covering neighbourhoods are just doing only general response policing. And it's a sorry state really. I'm not blaming the Chief Constable, he's got to police the streets. And it's the only way he's doing it at the moment. He's doing a good job, but it's in difficult times.
Councillor Sutton, I think you want to.
I think this is what this type of change creates, doesn't it? Is that lots of people are making suggestions on what they would like to see as a solution to this, and other people make different ideas. Some local authorities might have one view, others might have another, and the problem, as I see it, is that creates conflict for people, and they concentrate on that more than what's happened. All I would say on that point is that at some stage a decision will be made, won't it? And let's hope that the decision makers take into account what disruption to the system and the people who receive the services on the ground will suffer at the end of the day, and that's a consideration. And I'll just go back to what I said previously, Paul, is that we have got to just concentrate on Staffordshire at our current boundaries, children's services, and ensure that we deliver what is required for those children, following what Ofsted said for that improvement. but not forget that, you know, we do need to work with partners around, you know, and other local authorities around the area. You know, I think Natasha could talk a lot about the work that's done in the West Midlands region around placements and other things and fostering, where we try and work together to improve and make it better, both in a cost terms and in availability, and also for the outcomes for children. So we do need to do that, but we mustn't get hung up, I don't think, in the what-ifs. We just got to try and concentrate on what we need to deliver and improve on.
No, thank you for that. And I think I would echo that. That is a really important point, isn't it? And at least we do recognise those challenges in that uncertain world that perhaps isn't too far away. So I share your view. Councillor Eggeller.
Thank you very much, Chairman, and thank you for your report and yeah. Can I just put my district and corporate parenting hat on a minute? I know I'm in the Safeguarding Committee, but I'd like to ask Natasha what sort of discussions she's had with district, because all I get back is, you know, we're responsible for housing, but I'd like to know what conversations you've had, so it'll help me move forward with the districts as to what I can bring to corporate parenting. Thank you.
So we've only been to see 4 of the 8 districts and boroughs, so what I'm about to tell you is taken with a pinch of salt really in terms of being representative of the whole, but it came on the back of going to renew the housing protocol. So when you talk about practice standards, the housing protocol is a name for the way in which we'll practice in relation to housing children who leave our care. So we signed that off by the chief execs, and at that point they said that actually they felt like there would be some benefit from having some conversations about the way in which we work together, because they felt like they'd become, I suppose, didn't have clear visibility of the oversight of how well that policy or protocol was being implemented, which I think is positive. They acknowledged the fact that actually the protocol had been in place for 12 months, but they didn't understand, well, how many people are we placing, for example, in unsuitable accommodation. So we've been out to speak to the 4. I would say so far there is a willingness from the district and borough councils to want to work better with children's services. All of them have taken it slightly differently. A couple of them have decided that they want to hold a quarterly meeting with the district lead so that they've got the finger on the pulse in terms of understanding what's going on for children in their patch and how they might support them. All of them have agreed that actually their local partnerships are in different places, but having some oversight and visibility of what's happening for children would be helpful. And that's where the work around the locality profiles is playing in. So we are taking to each of the districts and boroughs a locality profile that will help them understand the data from their district's perspective in a bit more detail, and really allow for some discussion really around what's that telling us and what do we as a partnership need to do differently on the back of it. Each of them have taken it slightly differently. So in Tamworth and in East Staffs, they want a cabinet agenda item on children, so that the cabinet have got that visibility of what's happening, which I think is positive. And all of them have shown a kind of general willingness to kind of stand behind and support a kind of renewed and refreshed way of working better together from a partnership perspective. So I think the initial signs are that it's been quite positive. I think we've still got some work to do to make sure that we understand the needs of the districts and boroughs and how they might be slightly differently, and also making sure that the things that might be kind of red alert for the whole county are dealt with appropriately. But actually, I would say largely they've been quite positive. We've still got some trickier conversations to have, I think, because some of the districts and boroughs that we haven't been to see yet are probably the ones where we're having some of the issues around use of unsuitable accommodation. And I think, Paul, to your point around kind of short-term planning, actually those conversations are forcing us to have conversations that are a bit more longer term. So, for example, I'm not saying I want to have a conversation about little Johnny who might be homeless on the Friday. I'm saying I want to tell you the kids who I've got now who are 15 so that you can plan the buildings for them to live in, because it's pointless me having the conversation at Friday afternoon because you can't find me a house. So I think we are trying to kind of impose that conversation on the districts and boroughs and help them to plan better. What I would say is what's been quite reassuring actually when we spoke to the districts and boroughs is that a lot of them use third sector housing organisations like Bromley Housing, Aspire Housing, whoever it might be. And actually I don't think they'll face the same level of disruption in this space as we kind of grapple with local government reorganisation and devolution. So I feel quite positive in the early conversations we've had with housing providers that their awareness might not be there in terms of the corporate parenting responsibility, which we can help them with, but actually there is a willingness to want to work with us that I think will stand as the test of that kind of, you know, more uncertain time, really. So I'm not sure, Anne, whether there's anything you wanted me to pick up in addition.
Thank you for that, yeah. And I just echo what I said at the corporate parenting panel. I'm really pleased with the amount of work that goes on with children in care. Looking at past history, you know, how it evolved then, I think it's absolutely great that you are doing and looking after these children the way that you probably possibly can. But if I put my chairman hat on from the district as community and wellbeing, this is probably something we could pick up on that committee, you know, and bring it forward and see what we can do in helping. So, yeah, thank you.
Can I just come back on that point, Anne, because I think it's a really important point. So one of the districts has said, who's the cabinet lead in the district and borough who we want to link in with to make sure that there are those connections made. So that's a really helpful example that others could probably take on board and have different conversations with their districts and boroughs if they're also a district and borough councillor.
I suppose just following on from that, part of the concern would be if the districts and boroughs want to do their own thing and you're having or seeing some difficulty or challenges in that. Is there a view for the future that there will be some sort of continuity around how some of these issues are dealt with, or will we be dealing with 4 or 5 different processes dependent on where children live?
So no, there is a Staffordshire-wide housing group that comes together that brings all of the districts and boroughs in one place, helps to share good practice really around the way in which people are enacting some of those duties. I think it would be unfair of me to say that where we're having issues, it's because of a district or borough working in a different way. It's not. It's because of the availability of property and the affordability of some of that property. So at the same time, we've also been working with adult services, and we met with them just yesterday to talk to them about some of the work they're doing in terms of supported accommodation. So children have got access to supported accommodation up until their 18th birthday from children's services. Adults are commissioning something similar for adults, and we're trying to influence them so that actually where the districts and boroughs haven't got that availability, or actually sometimes where the child's behaviour is quite disrupted and they need some additional support to help them to live independently, that actually they're able to recognise that within their commission. So we're doing some work with them at the moment to try and make sure that that's reflected. So hopefully that will iron out some of those anomalies really that we see.
No, thank you for that. Councillor Eaglin.
Thank you very much for that presentation. You certainly set yourself a huge task for the future, and I agree with what you've already said, that it's the here and now and not what the future holds as regards to evolution. You've got to, quite rightly, as you said, you've got to concentrate on what is here for you now and your long-time predictions. But I haven't any questions. You asked a question that I was going to ask, but thank you very much.
I can only apologise for that. Just on, I noticed that we talked about dentistry earlier, and it just reminded me of a serious case review. I don't think they call them that anymore, do they? They're called something different. But and it was a couple of years ago. But the issue was around dentistry and some young people that we were caring for. And it wasn't about the fact that we couldn't access dentistry. It was about the fact that the young people didn't attend, and as a result of not attending, they were then just taken off a list. Is there work done around improving that as a process? I read recently that we used to record things as DNA, didn't we? I did not attend, I think, but now some local authorities are recording them as was not presented or something similar. I can't remember what the wording is, but I think it was recognition that it's more to do with the process about how we stop young people falling through the net.
I think there's been some focus on this piece of work in the Corporate Parenting Board and an expectation of health to look at their processes, which they have done. And I think that we've seen an increase in the number of children who are attending appointments, but also it's about how how children are engaged in understanding why they should attend dental appointments, but also supporting foster carers to get to take children to those appointments. So if the appointment's made at 3 o'clock and you've got 3 foster children that you care for, and you need to be in the dental appointment and picking children up from school, it's a little bit of a challenge. So it was about health, thinking about appropriate times, being a bit more flexible, and some of that work is ongoing, but we have got kind of overview and ongoing dialogue about that position that we're in. We find that with older children, their attendance falls off because they don't want to go to the dentist. Some children opt out, so it's about trying to engage children in conversations. But we'll all know for those of us that have our own children, that some of those conversations can be quite difficult to explain why you need to go to the dentist when you're 16, 17, etc., and then beyond that. But I think that we would say, and Councillor Sutton as the chair of the Corporate Parenting Board, that has been an area of focus and an area where health have been asked to really explore what they're doing, how they're doing it, and how they can do it differently.
Councillor Sutton.
Just very quickly, it brings me on to a similar related point, and that's the expansion really of the corporate parenting panel to other partners who are coming now on a more regular basis and taking time to input on things, and particularly the regularity now that health come and produce reports that the panel can examine and seek assurance. And I'm sure Anne would probably agree with me on that.
No, thank you. That's really reassuring. Councillor Snape.
Just to come back on the dentistry thing, it's not really just a thing in dentistry, it's a thing across the whole health service where adults particularly been referred, say, to a cancer specialist, for some reason didn't attend, then just did not attend and never referred back to GPs and stuff. So it's a thing I think we've got to look at across the whole health service. If one of our children are referred somewhere and for any reason they don't go, we sort of can follow it up in any way we can, because hospitals across the region are just saying did not attend and wiping the record in one way, not going back to a GP. So it'd be horrible if one of our children was to lose out on a did not attend.
Can I come back on that? So as a Safeguarding Children's Partnership, a couple of years ago, we did some work around the Was Not Bought policy. So health partners do have a policy whereby they will chase them up 3 times and then they formally write to them and notify the person who's working with them, i.e. the social worker or the early help practitioner, so that actually they can do that follow-up conversation. So I'm confident that there is a different system in place for children that hopefully provides a safety net, so that actually it's not just a one time and you're off thing.
Councillor Gill.
Yeah, picking up on Mark's point about the sitting on the health committee, it's high on our agenda, dentistry, and what we can do. I mean, I think I mentioned at the meeting at Corporate Parenting about my 2-year-old great-granddaughter cleaning her teeth, and it's interesting to see a young child that takes such interest. And this comes from her going to nursery, actually. So nurseries have got a big part to play in training children to clean the teeth from a younger age. Can I also mention, and go back to the housing situation, I have said this before in a meeting, I've got a gentleman, he's a magistrate actually, and he sees the problems that come before him and what have you, and he's had talks with the county, and he wants to build a housing get a buildings where he can help these children that's wanting accommodation. That's all he wants to focus on, looking after the children that's leaving care and giving them housing. And he's a magistrate and sees all the problems, so we're still working on that in different areas. There's a piece of land coming up for sale at auction. He's on about buying that piece of land and wanting to build on it for what we've just been talking about, housing for the children that need it.
Thank you for that. I think just final question then. Around data and quality assurance, that's one of those things that constantly comes up. Are there any dates when we could look forward to getting usable data and quality assurance? I think we mentioned about a dashboard of some description, but that's been mentioned many times previously, and it is one of those things, if we are to scrutinise effectively and make sure we're heading in the right direction, then data and quality assurance is a vital part of that. I just wonder when we can look forward to an effective process to do that.
I think, as we've said, we are in the process of procuring a new system, and I think when we're clear about when that system lands, that will make it much easier to access a data dashboard that is usable and accessible for members. Between now and then, I think it's hard to make a commitment to providing a dashboard that's got the clarity and the clarity and simplicity. We've got vast amounts of data, but in terms of headline data, we'd need to consider how we might better provide scrutiny with an overview of a dashboard. We can take that away and look at it again. But I'm sorry, I can't give you a clearer timeline.
No, I think it's reassuring to know that that there are plans in place, and that will hopefully answer the questions that have been asked. So, again, thank you very much for coming along and talking us through the slides. It is clear that a great amount of work and effort has taken place, and thank you for that, to keep some of the most vulnerable young people in our communities safe. And it looks like we've made quite a lot of progress. So I do, again, thank you for all of that hard work, and we look forward to the next briefing. Just a few minutes for the musical chairs to happen. There we go. We'll move on then to agenda item 5, adult MASH performance. Ruth, thank you very much for coming along. I'll let you settle in.
Just going to say I'm all alone today. I know. They had 3. I'm here on my own.
Again, thank you for coming. This must be the worst interview panel you've ever had then. I'll look at it. Perhaps you could just take us through that report.
Of course, happy to. Thank you for inviting me back again. I wonder whether sometimes you might want a change of speaker. You hear from me quite a lot. But it's always good to come before you, just to give you an update on where we are with adult safeguarding. And particularly in light of some of the changes we've gone through recently, I've obviously reported to you on a number of occasions of the improvement project that we had underway for over a couple of years, which is now obviously completed. But I really felt that it was important to give you as well an update on the adult MASH. Partly because, well, mainly because I think this is a really intrinsic part of our safeguarding journey for adults. The MASH is the very start of the receiving of those information for those adults most at risk within our communities. So the new arrangements, in some ways it's been alluded to in your earlier item as well, have come about following the changes, as you were aware, from a joint MASH, which was with Children's and with Stoke-on-Trent. Obviously, there were some changes from Stoke-on-Trent's side, from the Children's perspective, which then raised the question for the MASH arrangements as they were. Following lots of consultation and lots of meetings, as you were aware at my previous overview meeting that I attended, an adults-only MASH was agreed. First of all, this was agreed as just a Staffordshire adults MASH, but I'm really pleased to say that this is now again joint with Stoke-on-Trent adults with a shared arrangement, which for me is a real positive in ensuring that we've got consistency across our two council areas, and also as well now considering those potential impacts of any devolution, etc., which I won't go into too much detail today. However, One of the things that came out of our previous review of the old MASH arrangements was a lack of consistency in reporting of the data within the MASH. And actually, for me, which is more important, the effectiveness of those arrangements. It's all well and good as talking about the numbers of concerns we've discussed, the number of concerns we've shared with partner agencies within that environment, but actually for me it's the effectiveness of those decisions that are made at those early decision-making points to make sure actually we are safeguarding adults in the most timely and appropriate way. So the work that we've been doing over the last few months has been to establish some arrangements with ourselves and Stoke-on-Trent. So we've set up a strategic meeting where the leads, which is chaired by myself, where we come together across the partnership arrangements, including police, etc., to look at what we want to happen and how our arrangements are going to work. So we've had to do quite a lot of work around looking at the expectations of what the different agencies are. And we have now come together, which is hopefully what I'm showing you today, with those arrangements with regards to how we're going to look at the performance and the quality of the MASH arrangements. So to inform that initially, though, we have already commenced a series of audits, of multi-agency audits, to look at what the current, because you need a baseline, don't you, to know what you're currently working with, and also to be able to look at what the expectations are. So we've already completed, as you can see, they may be small in number, but actually they're quite representative of the types of concerns that we're looking at, and already developed some learning from that. So as you can see, through those information sharing requests and through those audits that have been completed, we've already identified that there are a couple of areas where we needed to do some work on immediately to ensure that we had consistency in approach. Those being around strategy discussion recording, which is making sure that we're clear on who, I know this might sound basic, but who actually was involved in that strategy discussion, so we can see who that conversation took place with and what the nature of that discussion was. Now, that doesn't always include all of the information, because as I'm sure you're aware, we can't record all of that into our systems because we obviously have different data protection elements that we need to include, but that it's clear that we've actually considered all of that relevant information. The other part of that was around the ISL, which is the information sharing log, which is that system that we use to share information. And there was actually very little consistency at that time around the types of requests that were coming through, and also the risk rating and times that were required to respond. And that was the difference actually between the police's view, Staffordshire County Council's view, and also Stoke City Council. So we firmed all of that up straight away so that we could have that consistency right at the start. So those have all been agreed. But as I reported at the time, we were in the process of developing the performance report and looking at what, and we've had some agreement over those areas that we're going to cover. So as you can see in the report, that's going to include things such as the MASH requests by submitting agencies, so we can see the numbers, just our basic numbers as to who is referring in and when. The requests by priority, and part of this is following on from the audit that we initially did to ensure that the priority that's being given, the risk rating around those going on, is being consistently done, following that additional guidance that we've given to staff. The response times for these, recognising that services aren't always fully staffed, but we want to be monitoring to make sure that those that are at the highest risk are being dealt with within those timescales. And then also the outcome of requests. One thing that I've never been able to show, which is shocking really, is actually what the outcome overall of those discussions have been. I can look at it on an individual basis. I can tell you how many joint inquiries we've done with police because of data that I have through my asset team. But actually, from a MASH perspective, I can't see what was initially agreed to compare that then with the outcome of the actual inquiry once it's been completed. That bit as well, and I will say at this point, for me is really important then to see the effectiveness of those arrangements, because actually are we making decisions within the MASH, which are then later overturned within area teams or within area policing teams. So to be able to monitor those through our audits, which we'll then be doing to show the outcome of those inquiries, to be able to look at the effectiveness of those arrangements, we'll have all of that data and be able to pull that much easier. Well, that's our intention. And then alongside those, it's around having a much clearer understanding of the demographic of people that we are discussing within the MASH. And this links to some of those other conversations that I know we've had previously within this around our overall safeguarding data. So things, for example, actually, which district do people sit in? We look at things as county-wide quite often, but as we're aware, there are distinct differences within each of our district and borough councils. So to understand that, looking at the age that people are referred into us, gender, ethnicity, religion and sexuality. And part of this is to try and improve as well our overall recording of safeguarding data. As you know, we've discussed previously, we've got gaps in some of these demographic data, which does cause us some problems with completely understanding our data. Now, it might seem like a low expectation that we've said to start with. We're looking at 80% of all requests to be triaged within timescales. But this is actually, for me, a recognition, as I've said, that our staffing levels within each of our service areas, isn't always there, but it's around making sure that we're always meeting those higher risk ones. So that's where, with most things, some of our lower risk ones might be outside of timescales, but not by much. But we want to make sure that we're hitting those targets for the higher referrals. So for us, in actual fact, it's 100% for those that are put on as high risk should be triaged within that time, but 80% overall for the low risk. So it is a little bit, as I've put in here, dynamic. That's quite an interesting word to say, because we are still working through what data we can get and from where. Unfortunately as well, this has been delayed a little bit because of both local authorities having CQC inspections in January has actually delayed. We were going to have an initial trial in January, but we actually had to postpone that because of the pressures within both service areas for both local authorities. That doesn't mean that we haven't continued to do the work with regards to audits, just that the production of the report didn't happen. However, I've got the meeting on Friday of this week. It's just unfortunate that I did go and say, oh my goodness, I've got the meeting after this overview and scrutiny today. But we've got the meeting on Friday where we're, that's okay, where that's being finalised. With a then report starting. So we've got the report itself, we still intend that will commence formally in April, which was our intention. Just our initial trial of it has been delayed, but that should all still work well. But my real ask for you today as a committee is to, obviously I'd like, if you feel it's appropriate, for this to be something that I do report into overview and scrutiny as part of a regular update, and also would welcome your feedback on other parts of information, other aspects of this work that you would appreciate us including in our overall performance report to yourselves, that's going to give you the assurances that you need around the work of the adult MASH. Thank you.
No, thank you for that. Thank you for running us through that, and also the offer of coming back on a regular basis. I think most people would certainly welcome that. Just a couple of general issues, and we seem to go through these things, don't we, quite in Staffordshire around when it comes to children and adults. And 1 minute Stoke-on-Trent's in, and then they're not. And then the adults are in the mash with children and young people, and then they're not. And I'm sure at some stage an individual must have sat where you were and made a very convincing argument about everything needs to be together for cross-fertilisation of intelligence. And because I dare say when it comes to vulnerable adults, there may well be a vulnerable child also somewhere in that picture. So could we get some reassurance that by splitting for whatever reason, and I'm sure there is a legitimate reason, that we're not missing that cross-fertilisation. We're not, we're not picking up vulnerable adults because we don't, those in children's safeguarding don't speak to each other. So, is there some reassurance that we could have that, for whatever reason the split happened, then we won't, people won't go under the radar?
And I think that is a real, important point, isn't it? And I think we all recognise, don't we, that our young people of today are our adults of tomorrow, aren't they? And actually, generally, where there's adults, there's potentially the needs of children present. So the benefits of our new arrangements really is that we're still all in the same building up at Lindham House. We still have those joint working relationships with regards to information sharing through the ISL log. We're still the same requirements that we were meeting previously. We still, in that sense, share, although we've got separate policing teams, we still have a dual, the triage process by the police covers both children and adults. So we still have that cross-fertilisation, as it were, of information. We also have good links, and I did pick up earlier as well, between our practice lead, who's our PIPOT, so people in position of trust leads, where we've got concerns similar to the LADO role in children's, and they still meet regularly as well to look at those areas of crossover. So for me, having the information sharing log, having still those connections of being in the same building and relationships between the various managers still being present, that to me offers some assurity that we are not missing those young people or those adults within young people's situation who should sit between both services. And I do know of quite a recent strategy discussion that was held, which was joint children's and adults. So these things are happening and are happening still currently.
That's really encouraging to hear that we don't lose that. When it comes to data and the effectiveness of that data, you just outlined, one of the things that always strikes me when we see the data, and we see it separate from Stoke-on-Trent and Staffordshire, and it may reflect the demography and the breakdown of those two areas, but you'll probably remember that there are some stark differences in it from time to time, where people are more likely to be abused. In one area it's in the home, in another area it's somewhere, I can't remember exactly the detail, but perhaps in a care home or something similar. And we also had quite an increase in, or a decrease in reporting from ethnic minority groups, I think particularly in Stoke-on-Trent as compared with Staffordshire. If we go for overall data that for both sets, are we in danger of losing that granularity that says all of a sudden now we've got just a general picture and we're unable then to pick up issues around ethnic minority groups and underreporting? It just paints a single picture, which it's, I hate to use the phrase watered down, but now we just get a very general picture of what this looks like that must be less impactful and important for those who are tasked with or charged with trying to sort it out.
and I can understand the potential concern that that's what this could look like, but absolutely the opposite from my perspective is that we will be breaking it down actually by district and by area. So hopefully we're actually going to increase the sort of granularity of the information and not to detract either from the sort of the individual needs that may be between those different districts. And that's actually, I know that I gave assurances last time I was here that we were going to do some real active work around ensuring that we were getting information out to our communities, but also we're hearing back from all of our communities. And this is part of that work, so that actually we are better recording that information, and that actually, and this is why I would like to have been able to come and show you what it was going to look like, and I haven't been able to, unfortunately, but hopefully next time you'll be able to see that actually we won't just be reporting overall numbers. We might do, but then beneath that you will be able to see the data relevant to each area. And this was also linking into when I went to Health and Wellbeing Board and was asked by another district councillor, oh, could you break this down by district and by borough? And I thought, well, we absolutely could. We just haven't been to that level. So let's start doing that and give people the information that they need.
That's really reassuring. Thank you. Councillor Burnett-Faulkner.
I'm sorry I was late this morning, Chair. I had a traffic issue. Morning, Ruth. I've got concerns about safeguarding issues which arise in the hospital and on hospital discharge. How do we monitor this? Because it seems to me a lot of vulnerable adults are passed around to and from various wards, care homes, sent home early when they're obviously and clearly not fit to be sent home. How do we monitor that?
Thank you for asking that question, because it actually came up yesterday as well for us in our Safeguarding Board Executive meeting as well, just looking at some of these areas. Now, I certainly do know that we, and I know it's been reported into the overview and scrutiny for health and care with regards to our effective arrangements that we have for discharge to assess arrangements. So we know that we have quite effective arrangements in place for people who are admitted into our hospitals on discharge, but we are equally aware, and because I'm not complacent, we are aware that there are some people, because we actually have them coming more frequently into our first contact, and I shouldn't say frequently to think that we've got high numbers of this, but where people are more likely to present is within our first contact service as having been either discharged from hospital or more likely have been discharged from A&E or from what's it called? The name's just gone out of my head. You know, the short-term treatment unit up at A&E. Oh, gosh, what's the name? Yes, frail assessment. Thank you. Oh, brain, just sometimes I've got real issues at the moment. Bear with me. Those units where they haven't actually been admitted into a ward but are still poorly when they get home. Haven't required an admittance, and actually then they are unable to meet their adult social care needs. So we have quite a lot of urgent support into there. What I do know, though, is that what we can show from our data at first contact is that those people are triaged on the day that they're received and are likely to receive support within 24 hours. Now, I haven't got the exact detail here, I'm sorry, and that is something that we could get for you if that would be helpful. But as I say, I do know that this is an issue that comes up at Health and Wellbeing, because it isn't just a social care issue, that it is also an element for health and discharge from hospital. Where they are received into our adult safeguarding arena, which we do receive them from care homes where people have gone into hospital from a care home, come back with maybe either still unwell, changes in their need that the hospital hadn't communicated to the care home, etc. We do look at those on an individual basis. We either will complete that as a Section 42 inquiry, or we'll be asking for the hospital to complete an inquiry into that, to which they then do report that back into the local authority. So that's the assurance. What I don't know is those people that aren't referred into us. So those people that maybe have gone home that aren't referred into us. So I suppose it's what information is it that we're putting into the hospitals as well and on discharge to ensure that people have the right information if they get home as well and they're unable to manage.
I think one of the problems is that when they go into these assessment units at the hospital and then they're sent home, it's the fact that sometimes the families don't even know they've been sent home, or they get moved to somewhere else and they go into a new ward, it's a new doctor, new nurses, they don't know what's gone on the day before, and it's just not a consistency of care. And I think that is a big issue with the safeguarding and sending people home. And I don't know how you're going to overcome that, because it seems to me that there's one doctor on at 2 o'clock in the afternoon till 10, and then the next day there's a completely different doctor on, and the following day there's another doctor on. They're all saying different things, all writing different things down on the notes, and then nothing's get taken on and passed on to the next ward, or they've not received the notes because they're still in transit somewhere. And I think something there needs to be tightened up big style.
And I think that that's really important that we feed some of that information back. And if you do get examples, I would say, within your localities, do please, share them. One of the things that I like to, obviously use when, particularly at the Safeguarding Board, where we might not need to look at something as an individual issue, but the Safeguarding Board is a great conduit for raising some of these issues, and then using that to, using the processes within the board of scrutiny of those aspects. For me, I do know that there was some work done with our hospital colleagues with regards to where people have been admitted, at looking at how they were checking on the welfare after discharge, after 24 hours. And this it would be interesting to see whether the assurances that were given to the board, say 4 years ago, are actually in place still today. So, which from some of your comments may require that further scrutiny. So I'd be really interested if you have got those examples and have got, some of that information. I'd be more than happy to take that back into the Safeguarding Board, which I think would be an appropriate arena to be able to discuss that further.
Councillor Ed Geller, were you indicating?
I did, thank you, and thank you, Ruth, for that. And picking up on Jill's point, that's exactly the same question I put to the ICB yesterday through Tracy Shewan with the monthly meetings that we have. So, it has been picked up by the health people at the county. My question really relates to something totally different, and that is monkey dust. And I don't know whether you can answer this question, but I've heard it on the news and everything, that which is quite prevalent in Stoke, and I know it's in Stafford, that it's been downgraded from a Class A drug to a Class B drug. Now, what's your take on that? With thinking about safeguarding vulnerable people and what have you. Thank you.
Going to have to be honest and say, this isn't my area of expertise. What we do know, though, and what I would like to offer assurance is that for me, the class of a drug doesn't actually alter how we're going to respond to it from an adult social care perspective, which I think is really, key to the role that we can take to ensure that we safeguard people. We also know that actually there are some drugs that are legal that cause us equal problems at times. Now, whilst monkey dust isn't such a concern for us within a county, we are aware that there's pockets of this. Now, I attend a meeting alongside the police as well, looking at some of these risk factors where they lead to sort of high risk to do with things such as county lines, etc. And so I monitor some of these incidents through that to see whether we have got a growing concern in an area. So where we might be completing inquiries where people maybe reside within some of those particular areas, or where we know people have got particular risk factors associated with their lifestyle that might lead them to be at greater risk, that we have that awareness over, particularly over monkey dust. Actually, it came up at a recent meeting, which I have to say, monkey dust was something, although I was aware of, it's like I say, it's not really something, it's not an area that I was particularly aware of. But we do know we work with people where monkey dust has been a contributory factor. And so for me, we've had the drug and alcohol service come into my safeguarding team to do some talk around it, about what the impact is, and also look at how we can better support and engage with people, and whether we need to change our response in certain circumstances. It's also really important that we have those wider conversations as well with our mental health colleagues as well, because for us, quite often, as we know, there are those links between substance misuse and mental health, and also then the impact that might have on Mental Health Act assessment, etc. So those are the sort of threads of work that we're looking at. But I suppose the main point of it being downgraded, from my perspective, that's not going to change our response in how we support people, and also as well how we engage with the police from the point of view of preventative work that we might be engaging with them in.
Thank you. It's interesting you mentioned county lines, Ruth. And can I just say to people that county lines has been prevalent in this area anyway for the last 34 years. It's not something new. It's something that's been going for 30-odd years. Thank you.
Thank you for that. I also think that downgrading is probably more relevant to the police, isn't it, about what's called the supply side. And I suppose my concern and hopes there is that the prevention of trying to stop any drug getting to the street level isn't affected by the way that it's graded. I certainly hope it isn't. Councillor Snape.
First of all, Ruth, apologies for interrupting with that. The first point was just going from what Bob has said. The class of a drug and the misuse of drugs, that really will be a sentence. Perhaps an A may get 14 or 10 years, a B will be 5 years. It'll be all about police powers, really. The police will still deal with it. It just, for the courts, what the sentence is going to be. I know you will continue to go that line. There were 3 points really, or 2 points are DV. Having done a lot of work in DV since I retired from the police service, a lot of the assessments we ever did and people we dealt with on all the projects really were, if there was a female involved, there was normally a child involved. So really, as long as you're going to catch up between the two, really, even though it goes separate, there'll still be a safety net in the middle. I'm perfectly happy with that. And the other one is hospital discharges. After our last scrutiny committee, myself and the chair, and Helen, and Councillor Whitman, asked that it be on our future work agenda, that we look at it and review it really across the county. So as a scrutiny committee, we don't know what will happen after next election, but that we've already put it forward as part of our work agenda for the future. And the other thing is, we spend 72 pence every pound on social services. Every penny that's spent on the MASH, I'm pleased with. It's an open door for people to come in. It reviews everybody. It's got all the agencies in there asking the same questions and the right questions at the right time. So I'm very happy with the way things are going. So thank you very much, Ruth.
Thank you for that. Councillor Eaglin.
Thank you. Thank you very much for that presentation. I've got a few concerns and I've got a few questions, if you don't mind. One is, for many years, this council has been supportive with the corporate parenting panel and now overviewing scrutiny with safeguarding. One of our big concerns was always been for children involved with MASH. We've always looked on it, I have always looked on it, and since the visit more so, that this was the first stop for a child if there was any need for it. I read now in the report, and I've heard from you this morning, that it's been disbanded in view for an adult MASH. Could you tell me what the situation is? And also, when did Stoke-on-Trent decide to join the adult MASH and then discard the child MASH at some time or other? I know it's a lot to ask, but when you sit here over the years and listen to children's events on corporate parenting, now we sit here safeguarding, the two are linked. And I'm just concerned that Stoke-on-Trent, are they nitpicking? You know, I don't know. Thank you, Chair.
Thank you for that. And just to really clarify, there is still a children's MASH. So the MASH for the children's is still present in Staffordshire, absolutely. So I say it's upstairs because the MASH is on 2 levels and the children's is upstairs and we're downstairs in adults. We used to be all upstairs together. And I think there's different reasons. I think it's interesting, isn't it, as local authorities. I sit here, you know, as a sort of as an officer of the local authority, and even I can't explain sort of decision making sometimes, not of my own decision making. I can explain that. What I would say is there's 2 very different approaches, I think, in Stoke-on-Trent with regards to arrangements. I think in some ways we still have a joint adult safeguarding board with Stoke-on-Trent. So from an adult's perspective, we still work very closely from an adult safeguarding perspective across the county and the city. So that arrangement from the point of view of scrutiny with regards to the safeguarding board is still joint. And I was really keen on us keeping a joint adults approach because I see the benefits of that for our adults and also our young people coming through transition as well. Our counties are very linked. We have a lot of the same partners and a lot of our arrangements are the same. There's 2 different, obviously, leaderships within both councils from a children's and an adult's perspective, as you'll be aware. That's the same in Stoke-on-Trent. Stoke Children's had an Ofsted report that they felt identified that they needed to move out of the MASH, that the MASH arrangements weren't working for them. So it was a very clear decision from the children's perspective in Stoke to move away from that joint MASH approach. Now, from an adult's perspective, there was a change that happened, and I don't know what discussions they had internally that altered their view, but I'm pleased that they decided to stay as an adults MASH. They never officially left in that sense. There was just an agreement that they were going to, and then they decided to stay. And I'm not aware of what discussions happened within their upper leadership.
Thank you for that. I suppose the final inevitable question, really, especially if we are joining together with Stoke-on-Trent, is do we have an eye to, are we alive to the potential around strategic authorities and where Staffordshire is likely to go in the future? I'm sure people don't know, but it would strike me as a little concerning if we've just formed a partnership with Stoke and in a very short period of time they decide, as we heard last night, that they might go somewhere else. You know, we're unsure of where our own future is as a strategic authority. That will bring some challenges, I dare say. I just wondered if I'm not looking for a detailed answer because no one quite knows what the structure looks like, but are we alive to the potential dangers of that?
It's certainly featuring in my agenda for the meeting I've got on Friday, only really as an awareness raising, as you said at this point. And actually, I suppose just repeating what children's colleagues said earlier, we've got a job to do now, which is to continue the work that we're doing, and that's where our main focus will be. However, we also know we have to plan for the future. So we do have to look at these side by side. But some of these things, and you know, we none of us know quite how the landscape is going to look from 2028, isn't it, at the latest? How that's going to look. But what I know is that there will be adults within our area and within the whole of Staffordshire and Stoke-on-Trent who are going to need safeguarding. Our arrangements that we have now, I think, are going to play a part in how we face that uncertain at the moment future. The stronger our relationships are now and the stronger we can build them over the next couple of years, I think is going to be really, really important to ensuring that we do not unsettle or leave people at risk because of changes to our political state, if that's the right word. So for me, we have to acknowledge things are going to change. It cannot be at the detriment of the work we need to do now and for the next 2 years. But we can't ignore the inevitable change that is on the horizon. So it's with a watchful eye and with a responsive and hopefully cooperative approach.
No, thank you for that. Very reassuring. Councillor Snape.
Any change like this is going to affect our staff. Can we just ask that our staff are taken on board, kept updated, because we never know, there may be vacancies elsewhere where they could go to. But if we look, say if statute broke into 3, we'd need 3 heads of social services, 3 heads of this, 3 heads of that. Everything will be watered down, but as long as we can look after our own staff, what happens elsewhere, we can leave it to other people, but just please look after our staff. I know you will, I mean, it's just... Yeah.
I will just say they are absolutely my first priority outside of obviously our duties to the adults in our community. Without having staff that feel able to work, have a good environment to work in, feel safe and secure in the work that they're doing and feel that they know what's going on, they haven't got that uncertainty. Because if they are uncertain, that impacts on the work that they do. And actually, you know, I always say this, if we in adult social care can't look after our staff, we're doing something wrong completely. And what we do know is, and from all of the feedback that we've had through the CQC process, is our staff currently feel very well supported, very valued, and feel that they are working in a good environment. And that is something that we will continue to do.
Thank you for that. No other? No. Ruth, thank you again for coming in, and thank you for your characteristically enthusiastic, informed and hugely reassuring responses to all the questions. I do think that we always leave from these scrutiny sessions safe in the knowledge as far as we can that adults are being protected here in Staffordshire to the best of our ability. So please pass on our thanks to staff members and thank you for coming.
Oh, thank you. And I'm assuming then that you are all happy for me to come back and show you what we've done in a future meeting. I know we have the issue of post...
You're welcome back, Ellie.
We very much value your input.
There were 3 recommendations on the document. One was to talk about the frequency of reports back to us, etc. Just so we've just complied with the document, that's all.
I assume we'll come up with some dates then and in the work programme for that to happen.
Could I just suggest, to begin with, for the first year, I don't, you know, if it's too frequent, just tell me, that I at least provide you an update every 3 months with regards to the working of the MASH. To me, even if it's just on the end of another report that's coming in, I just think that it might help you to see the work we're doing, and then also to raise any other areas of concern that might then inform any future meeting agenda items. Would that feel agreeable without being prescriptive?
I think it will. It actually won't be me, because I won't be here, but I just wonder whether we delay the final arrangements until someone else is selected as the chair, just to see where it's going. So
I know.
There you go. But I think the answer is yes. The frequency perhaps we can work out as we move forward, I think. Yeah. Item 6 and the work programme. Please, sorry, I'll just...
Thank you, Chair. Yes, so our next meeting is unusually on a Friday. It's the 21st of March, and that's an extra meeting we put in to look specifically at school attendance attainment and exclusion. So It'll be an education-based one. Then after that, we've got a meeting that is in April where we are going to look at the children's MASH.
Yep.
So that will sort of be interesting to see after what we've discussed today. So those are your two that remain in this municipal year. And then obviously in the new year we'll be looking to plan the work programme for what ever happens. We don't quite know where we'll be or what scrutinies we'll have then, do we? So, thank you.
Item 7, then, exclusion of the public. I don't think there's anything else, is there? Again, a huge thank you for everyone to turn up and all your contributions.